Welcome to our presentation on cannabis use and cancer screening, specifically designed for primary care providers. We aim to shed light on the intersection of cannabis consumption and adherence to cancer screening protocols. Our study objective is to assess the association between the frequency of cannabis use and adherence to cancer screenings recommended by the USPSTF. We focus on screenings for breast, prostate, cervical, and colorectal cancers. We utilized data from the 2018-2020 Behavioral Risk Factor Surveillance System to classify cannabis use into three categories: 0 days, 119 days per month, and 20-30 days per month. Adherence to screenings was measured according to USPSTF guidelines. Our key results indicate lower adherence to breast cancer screenings among heavy cannabis users, and both light and heavy users showed lower adherence to prostate cancer screenings. Interestingly, no significant association was found with cervical or colorectal cancer screenings. A dose-response trend was observed, suggesting that increased cannabis use correlates with lower screening rates. The interpretation of our findings suggests that cannabis use is linked to reduced screening in cancers with lower USPSTF grades, such as breast and prostate cancer. However, there was no effect on screenings with strong evidence, indicating a potential behavioral or perceptual barrier in this population. The clinical implications of our study suggest considering routine screening for cannabis use during preventive visits. It's crucial to prioritize discussions on breast and prostate cancer screenings for frequent cannabis users, while emphasizing the importance of adherence to screenings regardless of substance use. Our study limitations include the potential for recall bias due to self-reported data, a temporal mismatch between cannabis use and screening history, and the cross-sectional design, which prevents us from making causal inferences. In conclusion, frequent cannabis use is associated with lower adherence to certain cancer screenings. Primary care providers should remain proactive in recommending screenings for cannabis users, and further longitudinal research is needed to deepen our understanding of these associations.